This is JAPI, and welcome to JAPI Podcasts.
This is JAPI. I am Dr. Mangesh Tiwaskar, and I welcome you to the JAPI podcast of January 2025 issue of JAPI, Volume 73, Issue 1. Friends, this issue has really very interesting articles, including 3 original articles, 4 review articles, 1 update article, 9 unique case reports, 1 pictorial CME, and 1 letter of correspondence. So let's discuss few of them in short. I'll be talking first about the first original article titled A Retrospective Analysis of Factors Influencing Maintenance Hemodialysis Adequacy, a single center study in eastern India. And this paper is by Dilip Pahari et al. Now, the objective of this study is to look at the quality of life in the maintenance hemodialysis, that is MHD, which is dependent on the consistent and efficient removal of the uremic toxins. Now, as we know that these toxins include a very small quantity of small to medium size of molecules, but the evaluation of the removal efficiency of hemodialysis is generally predominantly focused on the clearance of urea measurements only. KT by V, a widely adopted measure for hemodialysis adequacy based on urea clearance, was developed by Gotch and Sargent. Now, this KT by V serves as a standard of the metrics of assessing the effectiveness of maintenance hemodialysis. According to 2006 KDO guidelines, the KT by V exceeding 1.2 or the urea reduction ratio, that is URR, of 65% is advised for the maintenance hemodialysis conducted 3 times weekly. Now, this study was aimed at determining the adequate hemodialysis session and their associate factors for the patients undergoing maintenance hemodialysis sessions at their center. The material and the methods. The study was conducted over a period of 1 year, focusing on the patients receiving maintenance hemodialysis 3 times in a week. AT by V levels were assessed using the online clearance monitoring OCM technique. Results. The study included 251 participants, consisting 170 men and 81 women, with a mean age of 59.09 plus or minus 30 years. Diabetes was most frequently observed comorbid condition, affecting 138 patients, while fistula was a prominent type of the vascular access utilized in 198 patients. Hemodialysis adequacy was achieved in 81.08% of maintenance hemodialysis sessions. Patients on high flux dialyzers achieved the higher average KT by V compared to the patients on low flux dialyzers. Dialyzer clotting was associated with decline in KT by V. The study found out that MHD adequately was inversely related to both age and the previous pre-dialysis systolic blood pressure, while it showed the direct correlation with the duration of hemodialysis. Additionally, females attended higher KT by V values in compared to males. Logistic regression analysis identified male gender and blood flow as an independent determinant of the hemodialysis adequacy. Conclusion: MHD adequacy is determined by the combination of the factors rather than a single variable. Our findings indicate that achieving MHD adequacy requires combination of sufficient treatment duration, appropriate rate of the blood flow, effective anticoagulation for the prevention of clotting, stable blood pressure management, and the use of hemodialyzers with the surface area exceeding 1.2 meters square. Now let's go to the next original article titled Clinical Study to Evaluate Anti-Inflammatory Effects of Lactoferrin plus Disodium Guanosine Monophosphate Therapy in the patients with chronic kidney disease. This is by Raj Kanwar Yadav et al. This study aimed to evaluate the efficacy of lactoferrin and guanosine monophosphate GMP in reducing the inflammation among the CKD patients. CKD affecting over 10% of the global population is characterized by the elevated inflammatory markers such as interleukin 6 and TNF alpha, which contribute to the disease progression and the cardiovascular risks. In this randomized open label trial, 40 patients were divided into two groups, one receiving lactoferrin 100 milligrams and GMP 10 milligrams combined with the standard CKD management, and the others receiving the standard care alone. The study spanned over 29 weeks with assessment of inflammatory markers, hemoglobin, and the EGFR, that is estimated glomerular filtration rate. The results demonstrated a significant reduction in the inflammatory markers interleukin 6, interleukin 10, and TNF alpha in the test groups compared to the control groups, indicating that the anti inflammatory potential of the combination therapy is significant. While improvements in the hemoglobin and the estimated glomerular filtration rate was observed in the test group, these changes were not statistically significant. Safety evaluations revealed only mild adverse events which resolved without treatment discontinuation. The findings suggest that lactoferrin and GMP therapies would be a promising intervention for the management of inflammation in CKD patients. This combination therapy also offers a potential new avenue for managing CKD associated inflammation, addressing a critical need in the CKD treatment strategies. However, a larger scale and a longer duration studies are needed for the broader application and understanding its long term effects. Next article is an observational study of incidence and the risk factors of multivessel coronary artery disease in patients with acute coronary syndrome, presenting at the Tertiary Care Hospital in India by Gurjit S. Chaudhary Eda. This was a prospective observational study which was designed to evaluate clinical and demographic characters of the patients with the single vessel, that is SVD, double vessel, that is DVD, and triple vessel, that is TVD, in coronary artery disease. The study was done at a tertiary care center in the Department of General Medicine over the period of 18 months from July 2022 till December 2023. As coronary artery disease is a primary cause of mortality and morbidity globally, with acute coronary syndrome, that is ACS, comprising ST elevation myocardial infarction, that is STEMI, and non-ST elevation myocardial infarction, that is NSTEMI or non-STEMI, and unstable angina, that is UA, representing the leading cause for death in coronary artery disease patients. Acute chest pain relating to the back, jaw, shoulders, and one or both arms were the primary presenting symptoms. The pain may be also characterized by indigestion or heartburn accompanied by nausea and or vomiting. Additional symptoms may include shortness of breath, weakness, dizziness, lightheadedness, or loss of consciousness. The diagnosis of ACS depends on the combination of the clinical presentation, the electrocardiogram, that is ECG findings, and the biochemical markers indicating myocardial injury. In this study, over 111 patients which who were symptomatic with acute coronary syndrome were studied. It was observed that these patients primarily were of the age 55.7 plus or minus 13.7 years. Males predominated with 75.68% and females were 24.32%. Chest pain was the most common presenting symptom in 69. The single vessel disease, the double vessel disease, and the triple vessel diseases were seen in 64, that is 42.30, 17, that is 23.4, and 30, that is 34.2 patients, with most common vessel involved being the left anterior descending, that is LAD. Fatigue was predominantly found in SVD, chest pain was predominantly found in DVD, and shortness of breath was most common symptom in TVD with p-value of 0.049. Univariate logistic regression showed that none of these factors among age, gender, comorbidities, and the family history were significant independent risk factors for triple vessel disease, that is TVD. So, to conclude, it was concluded that acute coronary syndrome patients are predominantly elderly males with comorbidities like diabetes, hypertension, a family history of heart disease, and dyslipidemia. The left anterior descending was the most commonly involved coronary artery in ACS. The occurrence of SVD surpassed DVD and TVD among ACS patients. None of the risk factors were significantly associated with TVD independently. Next is a review article titled Ardostin Reigniting a Thiol Mucolytic for Management of Chronic Obstructive Pulmonary Disease by Agambora et al. Significance of the COPD, that is chronic obstructive pulmonary disease, is a prevalent lung condition causing chronic symptoms like cough, symptom production, breathlessness, sputum production, and dyspnea. In India and China, primarily 50% patients are because of COPD of the global cases. Role of oxidative stress is a key factor in COPD pathogenesis, leading to accelerated lung function decline, mucus hypersecretion, reduced effectiveness of the inhaled medications. Talking about ardostin, ardostin is a prodrug that transforms into active metabolite with mucolytic and antioxidant properties, improving the mucus clearance, reducing inflammation. The clinical trials demonstrated that ardostin is effective in reducing COPD exacerbations, improving symptoms like cough and breathlessness, and enhancing lung functions. Comparative efficacy with other mucolytics like N-acetylcysteine, that is NAC, and carbocysteine, ardostin showed a superior outcomes in reducing the exacerbation risks, hospitalization rates, and treatment failure in the patients of COPD. There are a few notable trials like the RESTORE study, which was published in 2017, showed a 19.4% reduction in all exacerbations and 57% fewer milder exacerbation. A meta-analysis confirmed its efficacy in reducing exacerbation risk and improving the quality of life. Ardostin also has an anti-inflammatory and antioxidant properties by reducing down the cytokine releases, proteinase synthesis, and pro-inflammatory proteins, producing the broader therapeutic effects in the patients of COPD. The independent use of inhaled corticosteroids, unlike NAC, ardostin benefits big way, and ardostin benefits were observed regardless of inhaled corticosteroid uses, making it a versatile choice in the diverse COPD population. As a guideline endorsement, global and European consensus guidelines recommended ardostin for the regular use in COPD patients, particularly those with chronic bronchitis and mucus hypersecretion. Ongoing studies such as BETTER trial, which aims to explore ardostin's potential benefits in the younger population with bronchitis, are further expanding its therapeutic implications. Next review article is Tropical Infections and Acute Kidney Injury. This is by Vijay Kumar Jha et al. Tropical febrile illnesses are important subsets of the disease leading to acute kidney injury due to their geographical location, hot and dry climate, which actually predisposes individuals for dehydration, poor health infrastructure, and prevalence of certain specific infectious diseases. Specific tropical infections need to be excluded while considering the differential diagnosis of febrile illness in the patients with acute kidney injuries, that is AKI. Untreated infections may result into high mortality, may lead to the long-term complications, and the clinical symptoms related to the other organ damages may help to narrow down the diagnostic possibilities of these tropical infections. These infections require disease-specific treatment to prevent morbidity and mortality, in addition to the supportive treatment. This review article encompasses the epidemiology, the pathology, and the specific renal pathological changes common to the tropical infectious diseases resulting in acute kidney injury. The tropical infections included here are malaria, filariasis, leishmaniasis, leptospirosis, rickettsial scrub typhus, salmonellosis, shigellosis, melioidosis, dengue, hantavirus, chikungunya, and HIV. I strongly urge all our listeners to read this article for understanding the disease-specific renal changes in these days where the tropical infections are again coming back. Friends, the next review article is titled Integrated Phenotypic and Endotypic Assessment, a Need for Precision Medicine in Asthma Management by Ajay Kumar Verma et al. Asthma, as we know, is a long-term persistent disease characterized by inflammation of the lower airways, presenting with various clinical presentations like chest tightness, wheezing, coughing, and difficulty in breathing. Asthma has been categorized into various phenotypes on these different bases like etiology, clinical characteristics, cellular composition of the airway inflammation, treatment responsiveness, diseases associated with asthma, and levels of type 2 cytokine profile, which is the latest inclusion in the category. But of late, we have to understand the different pathobiological mechanisms that can lead to the similar symptoms, which might be applicable to the different phenotypes. These apparent pathways are referred as endotypes, which are introduced to understand the complex pathophysiological mechanisms of asthma. Endotypes can be T2 high, T2 low, depending on the levels of Th2 cells, that is T helper 2 cells, involved in the pathogenesis of the disease. T2 high asthma are those who exhibit elevated specific genes activated by interleukin 30, CLCA1, post N, and SERPIN B, whereas T2 low asthma exhibits with the lower levels of these genes. Type 1 hypersensitivity and eosinophilic inflammation are the major characteristics of T2 high asthma, and these patients mainly respond to corticosteroids. Some distinct pathobiologic traits displayed by T2 high patients include rise in the subepithelial fibrosis and eosinophilic airways. T2 low asthma, on the other hand, comprises of 30 to 40% of severe asthma patients and is more frequent among the individuals with late onset asthmas, obese people, women, and highly symptomatic patients. They exhibit poor response to inhaled corticosteroids. Accurate endophenotyping of asthma can reflect its natural history and help to predict the treatment response. Thus, prospective studies are needed to understand asthma endotypes that might be useful in the clinical practice in future. The last review article is titled A Concise Review on Different Aspects of Influences of Coronavirus Disease 2019 on Liver and Metabolic Changes. Rajdeep Ghosh et al. Coronavirus disease, that is COVID-19, is a viral disease causing a deadly situation around the world, and we are all aware about it. Significant cases needed hospitalization and intensive care. Obese, diabetic, and immunocompromised people had very poor prognosis. Here in this study, we are trying to establish the link between the liver disease and COVID-19. A thorough investigation was performed across the several articles and database from 2020 to 2022 to assess the impact of COVID-19 on liver. As of June 2022, the team has identified 75 articles in the electron database discussing about the hepatic impacts of COVID-19. Liver steatosis, liver fibrosis, elevated liver enzymes may serve as a prognostic markers for the severity of the COVID-19 as they are associated with liver injury and chronic liver disease. The immune inflammatory response mediated by liver dysfunction is especially pertinent in these viral illnesses. This becomes especially critical with increasing incidence of NFLD, NASH, and COVID 19 virus. Tracking immunized patients with CLD over a period of time would provide an insight into underlying cause of their suboptimal immune responses. The COVID-19 pandemic had a detrimental effect on the care of the people with chronic liver disease received because of the lengthier wait times, decreased access to the healthcare services. Now, these disruptions are possibly likely contributing factors for the higher morbidity and mortality related to the chronic liver disease, and the delays in the diagnosing and treatment of the various liver conditions worsen the patient outcomes. Additionally, the pandemic led to the significant decline in the liver transplant and organ donations, while global efforts to eliminate viral hepatitis were also adversely affected. Patients' habits were detrimental to the liver health, combined with the pandemic effect on the liver related healthcare services, may exacerbate the global liability of the liver disorders. In people who are otherwise healthy, SARS-CoV-2 virus infection appears to result a very minor liver damage. Nonetheless, additional investigations are required to comprehend the long-term implications of COVID-19 on hepatic function. Now we'll discuss about an update article on the role of desmopressin in bleeding disorders, what Indian physicians need to know by Harshad Malve et al. Desmopressin, formerly introduced for the treatment for diabetes insipidus, is a well-known analog of vasopressin that is an antidiuretic hormone. Subsequently, in late 1970, it has emerged as a medication of choice for type 1 von Willebrand's disease and minor hemophilia A. The prothrombotic factor 8 and von Willebrand's factor are released from the storage sites from vasopressin receptors which are targeted by desmopressin. It also facilitates the platelet vessel wall adhesion, resulting in substantial hemostatic effect. Research studies have shown that desmopressin administration can lead up to four-fold increase in the von Willebrand factor levels, highlighting its hemostatic actions. Desmopressin is commonly used in the conditions like nocturnal polyuria, leading to nocturia or nocturnal enuresis, diabetes insipidus, von Willebrand's disease, uremic bleeding, and hemophilia A. Desmopressin also is used to avoid rapid sodium correction along with the hypertonic saline, management of the intracranial bleeds due to the use of antiplatelet agents, and trauma resuscitation with active hemorrhage. It is also used in bleeding disorders, dental extractions, epistaxis, and menorrhagia, that is excessive menstrual bleeding. Hence, it is imperative that clinicians become acquainted with the use of desmopressin, which has now become a common medication for many patients with congenital bleeding disorders, and desmopressin is included in the treatment guidelines of von Willebrand's disease. Thank you for listening to the JAPI podcast.